Yes. Welcome everyone. Welcome, welcome. Thank you guys for being here with us this Tuesday. Take a few minutes, if you will, to complete the poll. And if you're willing, I'll say that, tell us where you are watching from, whether it's here in Georgia, in Metro Atlanta, or somewhere across the country, or even the world. Will you drop in the chat where you are tuning in from today? Atlanta, Great Falls, Montana. Okay, yeah. Hi, Miss Sue. Stone Mountain, Macon. So very close to Emory, Stockbridge, Henry County, yes. Hollywood, Florida. All right, we may have to extend a few gift cards today. My favorite. That's awesome. Atlanta. I hope if you are here in Atlanta, you have registered for our 22nd Brain Health Forum. We're going to be at the Carter Center. It's going to be hybrid, so if you want to join us on site, you better register now. We're offering a box lunch and a couple of other surprises for people that come on site. Albany, Atlanta, Marietta, hello. Carrollton, you all are coming from all over. That's awesome. And I hope you are sharing this with your friends and family. A couple of you all have emailed me and asked us to send the registration link. Dave's going to drop that in the chat so you can grab that link and have other people register. We have some great programs lined up in the coming weeks, so you don't want to miss those if you're going to be able to join us live. If not, every session is being recorded. And she'll drop our YouTube channel, the link to that as well. If you have been joining us every Tuesday, you'll know that we have a YouTube channel and the sessions are recorded and you can always go back and watch, or if you miss something, definitely take the time while you're driving or doing your exercise. You can tune in to any of the programs that we have been hosting. All right. It is 2:02. Welcome everybody. Again, thank you all for being here.
Oh, it is. Okay.
So glad to have you guys join us on this Tuesday. It's a little bright and breezy here today. Okay. Welcome. Thank you guys for dropping your information. We have people from Tucker, Marietta, Florida, Johns Creek. And I see Dr. Parker just joined us. Dr. Parker, look in the chat and pick one or two individuals that we would want to gift a Visa card to. While we were waiting for viewers to join, I asked them to tell us where they were watching from.
Okay, so let me see who I can see. SF Sailors from Stonecrest, Georgia. SF Sailors from Stonecrest, Georgia. And I'm going to go with Mona Moore from Huntsville, Alabama, because you're the first two that I see. Thank you, Jane from Rollberg.
All right, well, congratulations. You two are the lucky recipients of gift cards. We will, if you want to send me an email or message Deja or Crystal, we'll get your information, your contact information. We'll need your mailing address to get those gift cards in the mail to you.
Again, that's SF Sailors from Stonecrest, Georgia, and Mona Moore from Huntsville, Alabama.
Oh, I see someone from my home state, Arkansas.
Arkansas. If I'd seen him first, I might have called on him.
Yes. All
Sweet,
right.
right? The Razorbacks.
Yes, go Hogs. Okay, y'all, we're just having a little fun. We are 2 weeks away from our 22nd Brain Health Forum. Dr. Parker's going to tell you a little bit more about that. And then this Thursday, we will have our Minority Men's Health Matters session. So all of our minority men, we would love for you to join us. The content is relevant to all men, but again, we have a targeted goal of recruiting and engaging with minority men. So that's what we're in the business of doing this grant cycle. So again, if you can join us on Thursday, that would be great. All right, well, welcome again. It's Tuesday. We have a great program lined up for you today. I am going to turn it over to John because we start with exercise every Tuesday, right? Then Dr. Parker's going to come on and tell you who you can expect to hear from today. And remember, you can drop your questions in the chat, in the Q&A. If you have any burning questions, feel free to drop those. Dr. Parker's online and live today. I see we have 137 people who have already joined us. Again, welcome. Okay, John's coming on. Hi, Mr. Dollar. We hope to see you at the Carter Center this Tuesday in 2 weeks, okay? We want to see those faces, so you have to register. Okay, John's going to go. Remember, you go at your own pace. Go at your own pace. You don't have to participate, but we need you active. We need you moving. Movement is life. You must get that body going. All right, John, get us going. Get our heart rates up, and then Dr. Parker's going to come on and share with you who you'll hear from today for Brain Talk Live. Welcome, John.
Hey. First of all, I want to welcome you to Emory Alzheimer's Disease Research Center. Hey, in 2 weeks, I want to see you at the Brain Forum. So tell your friends, your groups, your organizations, I want to see your face. Okay, have that sturdy chair. We're about to have cardiomania. So if you need to take a break, take it, because we're going nonstop cardio. Remember, if you need to take a break, take it. Let's go. Let's warm up. Get that waist ready.
कभी आवाज दे कहीं से अजनबी तू भी कभी आवाज दे कहीं से मैं यहाँ टुकड़ों में जी रहा हूँ मैं यहाँ टुकड़ों में जी रहा हूँ तू कहीं टुकड़ों में जी रही है
There you go. We gonna keep that waist going. Come on. more air. Let's go.
जाते कहती है बता रे शम्सी हवा कहती है बता वो जो दूध धुली मासूम कली वो है कहाँ कहाँ है वो रोशनी कहाँ.
Good job. Woo. Let's go to work. 5, 4, 3, 2, and 1.
We're broken people now.
Give me that upper body. Let's go.
We're burning
Press. Come on.
so cold I'm bleeding now, now, now.
I need that upper body.
Let you down.
Watch it.
We're broken people now. We're broken people now. Tell me I won't never be nothing. If it's something I've risen from the bottom, I got them eyes on the front. Inside I'm damn right I overcame. Y'all know the name. We similar but never been the same. Everybody, yeah, they know the name. Now, we'll make it somehow. Make it some way. Yeah, you know we gon' get it today.
Reverb.
My own now. Won't ever let you down. Won't let you down. Yes, I've been through it. They know I do it for the people I'm fighting. So we be equal for my son and my sequel. And anybody who listening in they system like venom, I get in them and spread viciously. This is me.
Hey.
People now. We're burning out.
Come on.
So cold I'm burning now, now, now. Gonna let you down. We back at it, young logic, the rap addict, giving it every part of myself on the real. You would think I'd be asthmatic, allergic to your bullshit. Yeah, that's right.
Let's go. Get him up.
Real
Get him up.
time. If you rap it, get it tatted right now. It's right here, a vibe right now.
Okay, this is it. This is it right here. Let's go. Let's go. I tell you, we gotta get that cardio. Hey. Woo. We're going to New Orleans. Oh. keep moving. In 2 weeks, put on your calendar. We're gonna be live at the Carter Center. Put it on your calendar and tell friends. See you later, bye.
Yes, that is right. All right. I hope your heart rate is up and you are moving with John. Yes, we're going to be able to see him live and in person. You're going to get to get active, get moving at your own pace, but at the Carter Center. And you're going to get to see Dr. Parker in person, Dr. Law in person, a whole lineup, all dedicated to brain health. All right, well, welcome everybody. Thank you guys for joining us. I'm going to turn it over to Dr. Parker. She's going to tell you who you can expect to hear from today with a couple more updates. Welcome, Dr. Parker.
Good afternoon, everybody, and thank you so much for joining us today. We have quite a few people for you to meet today. We have Dr. Carolyn Clevenger, who's a doctor of advanced nursing practice from our Emory School of Medicine, who's going to tell you about an alternative way of delivering healthcare for people with dementia. You're also going to hear from Dr. A.M. Barret, who is a rehabilitation physician who specializes in the recovery of people after a disabling disorder such as a stroke. And the final person that you're going to hear from today is Dr. Nina Silverberg, who directs the National Institutes of Health, National Institutes of Aging, one of the agencies that is responsible for funding our Alzheimer's Disease Research Center and all Alzheimer's research throughout the country. The Alzheimer's Disease Research Center is funded by your tax dollars. You didn't know that, did you? So I probably need to make sure that attending BrainTalk Live is one way that you're seeing your dollars at work. We are supported again by the National Institutes of Health, National Institute of Aging, and our mission and our goal here is to give you resources, help you understand brain health, brain disease, if you will, but also to identify opportunities for you to participate in research that helps us improve brain health and overall health for all citizens. So when we talk about research, again, this is our carrot for you, our education, our John Lewis, all of that is all to get you interested in participating in some clinical research. And as we've discussed before, clinical research is not just being a guinea pig, taking medicines, giving blood, just getting a lumbar puncture. It's understanding how we age well, and what are the sorts of things that make it such that our organisms, which are normally healthy and disease-free, what makes them not so healthy, and what causes us to suffer from certain diseases. As you've learned, to age healthfully, we need to exercise regularly, at least 150 minutes a week. We need to eat properly for good cardiovascular health. We need to make sure that we get lots of rest. But more importantly, we need to learn something every single day about how to make things better for ourselves, not just us, but maybe the grandchildren will pick up after school after this program concludes. So without further ado, I am going to, one last thing. I have to talk to you about our Brain Health Forum next week, in 2 weeks. We will be at the Carter Center, as Cornelya Dorbin has already explained to you. This is where we started with our brain health forums, and we will be in a smaller space just because even though there are more than 500 of you who will sign up, only about 150 to 200 of you want to be seen in person. So we do anticipate you coming to the Carter Center if you check that on your registration. But if you don't, we anticipate seeing you online. And our program at our annual Spring Brain Health Forum will be virtual as well as in person. Next week, next Tuesday, we have you hearing from Dr. Andrew Sykin, who for those of us who want to have our brain studied, but we don't want to do a lumbar puncture or do anything else, we want you to participate in the ADNI-3 study. So without further ado, I would like to have our next presenter, Dr. Carolyn Clevenger. Ms. Dorbin, and the poll launch is on here right now. And I guess you answer that as you can. We're waiting on Dr. Clevenger. While we're
One
waiting,
moment, everybody. Yeah, Dr. Parker, we're having a few technical difficulties. Go ahead.
okay, I do see the link for our Alzheimer's Disease Research Center registration for 2 weeks. Please sign up right about this time, as much as you can, as Ms. Dorbin is trying to make it such that we get to hear from Dr. Clevenger. We might have to hear from one of the other persons first, but you're going to have to sign up. And again, next week, we're having Dr. Andrew Sykin from Indiana University, who leads a national observational study for Alzheimer's and related disease. And that's called the Alzheimer's Disease Neuroimaging Initiative. Okay, she's coming. All right, here we are, Dr. Clevenger.
This Tuesday afternoon. I'll begin with a bit of an overview, explanation about our program, this very unique practice here at Emory called the Integrated Memory Care Clinic, which is a primary care practice for people living with dementia. I saw at least one of our family advisors in the chat, so she will notice this, and for others, I will just say this is the first time I've unveiled our new logo. So anyway, there we are, Integrated Memory Care, where dementia is primary. The model in and of itself is fairly straightforward, although it's somehow very difficult to pull off because we're still the only site that does this, but it is the intersection of these three practice areas where people would typically go to a different site for these services. So we are at the heart of our practice, a geriatric primary care practice. My preparation is as a gerontological nurse practitioner, a geriatric specialist. And so I'm interested just as much in preventive care and how to keep someone well, including all types of immunizations, including the COVID vaccine, and also supporting people as they're managing other chronic illnesses that they may have and coordinating care among different services and specialties. The reality, though, is that managing chronic illness occurs within a context of cognitive impairment for someone who's living with dementia. And so we also incorporate best practices in memory care, or not just memory care, but let's say cognitive care, because some of our patients' memory is not necessarily their main issue. And when you're doing really good dementia care, that means that the caregiver, the care partner, is also partnering with you as the primary care provider in the practice. We have a palliative care framework or approach to the practice, which is that it's really important to us to understand what symptoms are being experienced and then to aggressively manage those symptoms as best we can, to anticipate what is coming next in this person's disease trajectory, and to make sure that the care partner and the patient, as much as they're able to participate, are also aware of that and then can maybe anticipate and be prepared and come up with some early plans for how they want to address those things as they come up. And that's what we mean by advanced care planning, both over the next 6 months and the next 6 years. The thing we don't do, and I think this is really relevant, is that we do not diagnose or evaluate someone. So this is not the place to come or to bring your person for concerns about memory lapses or behavioral changes or a decline in your ability to take care of yourself without support. That is the one thing we do not do. The other things we do around dementia care do look very similar to what happens in our cognitive neurology practice, which is that we manage prescriptions and medications for that, but we also do those chronic care pieces as well. A big component that's been really helpful to our families that we serve is to have direct access to the team. This is the team. This is a picture with a couple of, the clouds don't exactly match the individual, but we're pretty close here. But we think that the fact that we function as a high functioning team of clinicians on your behalf is the big key to our success. And so the model is nurse practitioners who are involved in appointments with patients and care partners, GNPs or gerontological nurse practitioners. We also have a psych mental health nurse practitioner who is on our team. We have a social worker as part of the team, a coordinator who is our sort of front door, the first person people typically talk to, and a registered nurse as part of the team, and actively growing right now. And that team comes together to do some things that are sort of typical of usual primary care, and then other things that are a little bit unique or different. So obviously, if you came to our building, you would say this looks just like any other office practice for primary care. There's nothing unique about the space. It's really what we do in it. We think it's really important in this type of practice that our visits include a consultation one-on-one with the care partner and the nurse practitioner in advance of that new patient visit. Sometimes they just need a space to tell us exactly what they're observing, what kinds of things have happened over time with symptoms, and they maybe things that are sensitive and they don't necessarily want to bring up in front of their person. So there's one-on-one dedicated time with the care partner, and then that new patient visit occurs. We do conduct something called a cognitive assessment and care planning visit, which is a good way to say, okay, maybe you received your diagnosis before you came in, you had to. Let's talk about where we are today. Let's talk about what we understand about that underlying illness, what stage we're at today. And because it's hard to come up with a plan if we don't know what we're fighting. And then ongoing follow-up from there. One of the positive things that has come out of the pandemic is that we are able to do telemedicine more readily. And telemedicine is a part of the nurse triage, so access directly to the registered nurse for any clinical concerns, that first line of working up what might be going on and to give some advice. Also, annual wellness visits occur over telemedicine with that registered nurse, and our social worker is able to do one-on-one coaching with caregivers or care partners. As part of groups, we do offer caregiver support and education, including Savvy Caregiver, and more about that in just a second. I think the other piece that's come up really critical for people ever since we've been open, which is about 6 years now, is the fact that after hours, on holidays, weekends, which seems to be when illnesses and emergencies happen, that our patients have direct access to our team. Either a nurse practitioner or one of our physicians will answer that phone and work with us, hopefully to avoid an unneeded emergency department visit, which is always a good idea for people living with a dementia diagnosis. But in particular, during a pandemic, you really do not want to be in that emergency department space if you don't need to be. And I'm sure our emergency medicine colleagues would also be glad if you were able to not also add volume to that space unless you absolutely have to. I should say we treat this clinic like a club. It's almost like being a member of a dedicated group. We're really clear about who is actively enrolled and part of the club. And that means that it's right now we're a bit full. And so we are continuing to accept new patients, but it's mostly as other people leave, so that once people are in, we make sure we're available to you. So not only to answer calls, but when something comes up, if you are having an influenza-like illness, especially right now, that you can get to the team on the same day if needed. So I talk about IMCC, that this is even though I think if you are someone living with this diagnosis or caring for someone who lives with this diagnosis, it's common sense. People want everything in one place if they can get it. Adding multiple specialists just gives families and patients one more thing to sort of keep up with, and those different practices don't coordinate with one another. So it seems like common sense, but in reality, we're the only place that this exists at this moment. There are other memory care consultation kinds of services around the country that do some really novel things, but they do not incorporate that primary care component into their dementia care program. So we're pretty unique and fortunate here at Emory that we're able to have this new model be tested and incubated here so that it may be able to, as it's been demonstrating success, be shared in other parts of the country. We've been fortunate to have a number of our caregivers and patients tell their stories in our Emory publication. So you may have seen us elsewhere here with Lloyd and Mary, and then also with Joe Young and Esther, and then of course with Jenny and Terry. I think one more, yep, Harry and Sandra. So really fortunate, and we think these are each members who have been with us, and their care partners have been participating as family advisors in many cases and shared their stories. So that's, I think, another big piece of our success is that we were inspired by family care partners who said we want this all in one place, and then designed by nurses to build the model. But as Ken said, one of the unique things that we've pulled together with our expertise, and actually I should add Ken's expertise, is some online and on your own pace caregiver education. And right now we are actively enrolling. You don't have to be a member of IMCC to participate in this program called Caregiving During Crisis. And this is a course that focuses on 3 big topics broadly. One is about keeping you and your person safe in a time of this pandemic, even as it continues on. Original infections, breakthrough infections, vaccines, booster shots, how to figure out whether or not you should allow someone into your home or not, or whether you should be leaving the home or not, especially if your person has trouble managing the mask wearing over both nose and mouth. So components around that. One component is around navigating the healthcare system. So trying to figure out all of these different terms, all of these different entry points for where you can access care, offices, health departments, urgent cares, emergency departments, the different staff who are there, who's making decisions for your person, and giving you some guidance and even scripts for how to advocate for your person, especially right now when many care partners, any family member, may not be permitted to go back with their person in any of these settings. And then a third component then is around day-to-day management, taking care of your person who's living with dementia, and some broad education on that role of being a family caregiver. So we are enrolling Caregiving During Crisis. You can actually email our team directly at caregiving.crisis@emory.edu. We will get immediately back with you. We'll get you set up, and this is part of we are studying the course to determine how helpful it is in helping people develop their mastery and confidence as a caregiver. So we will be asking you some questions. There's also an honorarium for your time and participation. So I cannot recommend this one strongly enough, as Ken said, especially in light of Dr. Cooper Smith's previous comments. So with that, I will just say, this is our practice. We are located at Executive Park as part of the Brain Health Center. Our landing page for more information is on the emoryhealthcare.org site with a simple / of IMCC. And I would be remiss if I did not say that while this is a caregiver inspired and caregiver supported clinical model with philanthropy. And so as we continue providing care, we of course welcome any support at this link for supportmedicine.emory.edu/IMCC honor. And hopefully, and I'm glad to share my slides as well.
Dr. Clevenger, would you please tell people what the requirements are for being a part of the Integrated Memory Care Clinic? There are questions about, can I come if I have MCI? Do you have to have dementia? All that kind of thing. Can you tell them what the criteria for being a patient in this clinic are and what the role of the medical doctor is?
Sure. So I'll start with the criteria, and I'm remiss in adding that. That was great. There are just 3. The first is that you do need to have a diagnosis by a physician, a nurse practitioner, or a physician assistant of a dementia syndrome. The model is designed for people with a dementia syndrome. It's not designed for individuals with mild cognitive impairment. You would probably not get the needs met with MCI because it's targeted specifically for people with that syndrome. So that's the first. The second is that you would be interested in changing primary care. So this is a primary care practice, not in addition to another primary care. So you would not be going to both. We would find medication errors, honestly, in prescribing things that maybe conflict with one another. And the third piece is that because this is your primary care, you need to live within 1 hour's drive of the clinic at Executive Park. Because we're going to want to see you. We're going to want to listen to those lungs if you're having a respiratory concern. We're going to want to see that rash. And so when those illnesses come up, you need to be able to live within driving distance to get there so that we can do the exam. So those are the 3. On our team, we also have collaborating or supporting physicians as they prefer. Primarily, we work with a geriatrician and also Department of Family Medicine Chair Ted Johnson, who works with us on topics that are related to sort of geriatrics primary care. And we work with Dr. Law in concerns related to cognitive neurology or dementia concerns. All of the office visits and care encounters are with nurse practitioners. So the physician will not see our patients in an office visit. We have morning huddle every morning and discuss what patients need services today or something that we want to bring to the team. Dr. Johnson is always part of those conversations, as well as our monthly case conference, but primarily they are available to the nurse practitioners as a resource. And we do a lot of collaboration and case discussions with each of them, primarily with Dr. Johnson, but also with Dr. Law.
There are a couple of other clinical questions. One of them has to do with explaining the palliative care approach. That's one. And the other has to do with hospitalization. What happens to patients in the integrated memory care clinic who might need to go to the hospital? How is that managed?
Sure. So a palliative care approach focuses primarily in two ways. One is that symptoms are priority for us. So we know that this is a condition that does not have a cure. We're researching the best way to care. And so we focus on first of all, assessing those symptoms and addressing them. Our symptoms tend to be things like what we call neuropsychiatric symptoms or behavioral symptoms. So that's really the focus for us. And we're trying to address those because that improves both the person who's experiencing those symptoms, it affects their quality of life, and it affects the people around them and their quality of life. And when those symptoms become severe, it can cause things like housing instability. So symptom management being priority and a focus on quality of life are really what we would say is a palliative care approach. Palliative care, I won't get too far down in this rabbit hole, but can fall into primary palliative care and specialty primary care. This is the primary palliative care. These are the palliative care things we actually expect all primary care practices to do, but we make sure it's front and center because it's so critical to us and to our patients and families. So that's why we call it out as 1/3 of the model. In terms of hospital admissions, when our patients do have to be hospitalized, and I do have to brag to say that our model has been able to avoid 90% of avoidable hospital admissions. And there's a specific way to define that. We are head and shoulders above any of the other dementia care models who have reported on that. But when someone does need to be admitted to the hospital, you know, the reality of our healthcare system in most places, including here, is that there really is a fair distinction between what happens in your primary care and what happens at the hospital. So we don't necessarily have control over the types of units hospitals offer or whether they have a geriatric specialist. And it's highly unlikely that you would have a geriatric unit or an acute care for elders unit or a palliative unit. If our patients are admitted to an Emory system, and we know that they've been admitted, many times people will call our nurse triage line or they'll talk to the staff so that we are aware that they've gone in the first place. Maybe we've made the recommendation for that. And we tend to be in frequent communication. And so we may reach out to the admitting service, whether that's hospital medicine or oncology or whoever the admitting service is, to connect with them because we want to make sure that the discharge plan is agreed upon and smooth. And sometimes we need to support that because maybe discharges to, for example, subacute rehab, and we can help facilitate that. But unlikely that people would go to a specific type of unit in the hospital. That really is under the hospital's purview and outside of our control.
And Dr. Parker, do you want to address the additional questions in the chat?
Okay, if there are additional questions that you have, we will address them in our chat. And we're getting ready for our next speaker, Dr. A.M. Barret. So if you have any further questions, please put them in the chat. We put in the information about the Integrated Memory Care Clinic in our chat. Again, this becomes your primary care practice. There are no medical doctors who will see you each time you come in there. It is only run by nurse practitioners who see you and confer with the doctor after you've been seen. So thank you, Dr. Clevenger. At this time, we'd like to bring on Dr. A.M. Barret from our Atlanta VA Medical Center.
Executive Director, the leader of the center on the 12th floor of the Atlanta VA. As you drive by on Claremont Road, you can give us a wave. I know many of you have seen Holly Hudson and Amy Rodriguez and Joan O'Sara, my colleagues, but we're going to talk a little bit about the center. And I'm not sure, can you go ahead to the next slide? We should be very proud to have a rehab research and development center here in Atlanta. There are only 13 of them in the country. And I know that you all are aware the VA has made a very significant investment in rehabilitation. So many of you may have experienced rehabilitation, whether it was physical therapy, occupational therapy, speech language therapy, whether it was inpatient care in a rehabilitation hospital or some other form of rehabilitation. Only the VA has a special research pillar and research centers really devoted to rehabilitation in this way. And we're very proud to have a center, the Visual and Neurocognitive Rehabilitation Center. Go ahead to the next slide. Our mission is to improve veteran health and quality of life in visual and neurocognitive disorders, so thinking disorders, and you all are quite familiar with cognitive disorders, and I know you're all probably quite familiar also with invisible limitations and invisible disabilities, and people who live with visual problems live with that every day. And we on the 12th floor engage in an alliance of researchers and clinicians, and we do rehabilitation studies. We're a collaborative center with different academic affiliations, very proud to be affiliated with Morehouse, as well as Emory and Georgia State and Georgia Tech. Next slide. So there are a number of different parts to our center, and really will invite you all, whether you're veterans or whether you love a veteran or whether you are just interested in promote and support an ally of veterans, when you'd like to come up when we open up again. We're slowly opening up some parts of our center, the VA Medical Center. We're not completely open yet. But on the 12th floor, we have a number of different kind of core operations that support our research studies. And these include administrative operations, of course, but also brain imaging, physical exercise that we'll talk about, and then molecular biology. Very exciting. Next slide. So here's the bottom line is that we have a couple different opportunities for folks. Again, whether you are a veteran, whether you love a veteran and care about and are an ally to veterans, or whether you're just interested and to participate in research in particular, because if you're female, if you're a woman, it will be that there are not enough people participating in research studies across the VA to represent our female veterans. So you could be a very important part of a study, even if you yourself are not a veteran. So we have a number of different exercise studies. We have a brain studies and a registry, and I'll just kind of take a happy little tour through those with you. Go ahead. Some of our exercise studies I know you've heard about in the past. We have some very fun studies of dance, and these are they're proceeding slowly through the COVID reopening time. But for example, for people with Parkinson's disease, and then also for healthy aging people, we have dance studies, and we're looking at the effect of partnered dance, ballroom dance, on the symptoms or the effects of Parkinson's disease. And we're also looking at exercise. So we have a number of really great participants, many of whom went ahead and exercised through the whole COVID time, exercising at home with equipment. So please get in touch with us if you're interested in this. To improve your heart and your vascular function, your artery function, but also this exercise appears to have the potential to improve brain function, and that's what some of our studies are examining. Go ahead. Then we have this word aphasia, and one of my colleagues who has had a stroke and has aphasia tells me he likes the word aphasia because it reminds him of a beautiful flower. But it is a communication disorder after injury to the left side of the brain in general. And so if you know someone who has aphasia, if you love someone who has aphasia, if you are just interested in this, because frequently in these kind of studies, we do have the opportunity for folks to participate for comparison who are healthy. We have these studies, and some of them involve looking at the brain. Some of them involve stimulating the brain with magnets. We have studies of kind of the brain's internal GPS. So spatial function, we call it. And when people have difficulty with the GPS, when the GPS isn't broken and not functioning properly, usually after an injury to the right brain, We can have this disorder called spatial neglect. And then we are also looking at brain stimulation with magnets, again, for people who are aged, but we also, very exciting, have studies in fibromyalgia. So if you have chronic pain, or you love someone who has chronic pain and they've been diagnosed with this problem, fibromyalgia, we have studies to really look at the basis of that, and again, the effects of brain stimulation on that problem. Go ahead. If you didn't see anything that fits you, but you still are kind of interested in contributing or being part of rehabilitation research, maybe you've had rehabilitation or you know someone who's had rehabilitation, you want to give back, or maybe you're just kind of interested and want to come up and see our center, we have a registry for future studies, and you can participate in the registry. So if you agree to participate, what we would do is take your name and your contact information and some health history. You don't have to be a veteran. You can be a veteran, of course. In particular, if you're part of an underrepresented group, you would definitely be somebody we'd like to have in the registry, because again, you would be helping to stand up for the veterans who are part of your group and might not be represented in research. And again, visual and neurocognitive disorders in particular are something that we're interested in getting in the registry. And people will call you and ask you about whether you're interested in volunteering for research projects. And if in the future we have other research other than the research we've talked about today, you'd have the opportunity to participate. And offline, we can provide people with a little QR code there, or the numbers, we can provide them offline as well. I think there's maybe one more slide. So we have a website y'all can come to. Feel free to investigate, to explore, or if you don't see what you want on the website, feel free to call us and tell us what you'd like to see. We would love to talk to you. Amy Rodriguez, again, who I think a lot of you have met, and Marianne Wetherill, who's also assisting with our connectivity core, our outreach group, are available and they can chat with you. And I'm also available if you need to make contact with me. Again, I'm AM, like the morning, Barret. So real pleasure to be with you all today. And thank you so much for inviting me to be with your group.
Thank you so much, Dr. Barrett. And I'm just going to repeat the number. If people want to pick up the telephone and dial in, it's 404-728-5064. If you want to call and get clarification or better understanding, or get help with navigating how to sign up for the registry. One question, Dr. Barrett, is this like across the board? I mean, are these studies and registries unique to the 13 centers, or can you go to any VA to access some of these services?
Well, we wish it could be national. Unfortunately, if you sign up, it's kept within Atlanta, and that's for reasons related to the way that the VA keeps things private. We can, though, and we do, connect people to opportunities nationwide. So if, for example, you want us, you're asking us, oh, hey, what's going on in Tennessee? And can you connect us to researchers there? We do every month attend these calls for all the research centers in rehabilitation. And, you know, in LA, in Boston, in Iowa City, Iowa, we have colleagues who can participate with you in getting you involved in research.
From you.
Dr. Parker, did you have any additional comments? I see you going in the chat, responding to quite a few questions.
No, I don't have any more other than to repeat that number. If you are a veteran or the spouse of a veteran, you can call that number and participate in any of the ongoing studies. You do not have to be a veteran to participate in the Center for Visual Neuro Rehabilitation and Research. It's a research registry, and many of you who have participated in the exercise research, many of you have not been veterans. So again, this is another example of your tax dollars at work. If you are interested in any of the VA related studies, please give them a call. Somebody in the chat wanted to know if this was available in Florida. I would suggest you go to the website for the VA in Florida to ask if they have the Center for Visual Neural Research located at that location. Dr. Barrett indicated that there were 13 different sites. So on to Dr. Silverberg. Thank you so much, Dr. Barrett.
To give you a little bit of background, the National Institute on Aging is part of the National Institutes of Health. There are 27 institutes and centers within NIH, and NIH is part of the Department of Health and Human Services in the executive branch of the government. And you can see here we have the Office of the Director, and NIA funds both intramural research, which is direct research conducted by NIA and NIA scientists, and the extramural research. And our extramural research funds research across the country and other places in the world as well. And we have 4 divisions within the NIA. We have the Division of Aging Biology, we have the Division of Geriatrics and Clinical Gerontology, the Division of Behavior and Social Research, and I'm in the Division of Neuroscience. And the NIA funds a lot of research on aging, looking to extend healthy, active years of life. And NIA is the primary federal agency supporting and conducting Alzheimer's disease research. And you can read a little bit more about NIA at the link there. And I will be happy to share these slides if it's helpful. NIA also has a lot of general health information for older adults. There are more than 200 articles on the web covering topics related to aging and diseases and conditions of aging, including vaccination, physical activity and exercise, healthy eating, and a lot on Alzheimer's and related dementias. And you can actually access not only what's on the web, but you can also have publications sent to you or to an organization for free. And so those are the links below to read and order some of that information. And then we also now run the federal government's Alzheimer's information webpage called alzheimers.gov. And here's a little bit more information about that website. It's a relatively new federal portal for information on Alzheimer's and related dementias. I think most people, as Dr. Parker was saying, have only heard of Alzheimer's, but there are many other types of dementia and other causes for dementia that we're still trying to learn about and hopefully treat. So the website has tips and resources for people taking care with people with dementia, information on participating in clinical research and how to find trials and other studies. We think it's important for people to know that it's not just clinical trials that you can participate in. There are resources for healthcare providers as well. If you are a clinician or a community or public health worker or other researchers, there's also information available on that website. And then updates on federal government activities that address Alzheimer's and related dementias. And so I'm going to talk a little bit more about the Alzheimer's Research Centers. They are labeled Alzheimer's Research Centers, but they actually conduct research on not only Alzheimer's disease, but also those related dementias, which includes frontal temporal dementia, Lewy body dementia, mixed dementia, and vascular dementia. So these centers serve as a resource and infrastructure for the full research community and provide a lot, which I'll be showing you in a minute, for the rest of the research community, not just people at the Alzheimer's centers. But at each center, as some of you may know if you went to Emory, provide diagnosis and education services for people living with dementia and their families and other people who interact with them, their care partners. And opportunities to participate in many types of research. And I think it's really important also to point out that they help to train the next generation of both clinicians, people taking care of folks, and researchers. So we recently, in this past September, expanded the Alzheimer's Disease Research Centers to include 4 exploratory centers. So we've really expanded geographically, but also the types of communities that the researchers are looking at, and also some of the scientific areas of focus. So you can see we have these 4 exploratory centers in Nevada, New Mexico, Tennessee, and Alabama. And as Dr. Parker also mentioned, I take it very seriously that we're trying to include everyone in research for dementia. And so part of the way that we do this is to help the researchers engage all segments of the public to focus on some of the communities that have been underrepresented in research. I think it's very important that we specifically include the people that are most affected by dementia and related disorders. So we've worked really hard to provide information to help with that. And here are some of the types of diversity that we see across the country in our different Alzheimer's centers. Some have a focus on rural communities. Some have a focus on African American, some have a focus on Asian, Latino, Native American, and then we have some other types of populations with centers with expertise in those areas. What we do is we take all that data from over 30 centers across the country and we send it to the coordinating center in Seattle. And we have images, we have samples, and those get sent and connected to the data. And so that's available to researchers, not only across the country, but across the world. And my next slide, I hope this is okay to bring up. I hope it doesn't make anyone uncomfortable, but part of where we get the information about new ideas or what may be causing Alzheimer's is from people's brains after they pass away. And so part of what I've been working really hard on is to not only increase the number of people willing to donate their brains or at least consider it, but also to increase the diversity of the people, because the largest proportion of the brains that we have that we've done research on are from white Americans in this country anyway. So I think that we really need more diversity, and we need to help people understand why it's important to donate their brain. And so we have this website that's listed there, Brain Donation, a Gift for Future Generations, that helps to hopefully explain what the value is for research. And I also included this link to, it's an older article, but I think still quite relevant. The author of the article in The Atlantic, her grandmother, had agreed to donate her brain. And so the author went to the place where the grandmother had agreed to donate the brain. So I think it's a well-written article and helps to explain why it's so important.
Thank you, Dr. Silverberg. So we're just about at time. We have 3 more minutes. If you have any extra questions, we'll answer them in the chat. I think at this point in time, Matt's going to tell you about cognitive empowerment, and I will answer the questions that are in the chat. Again, thank you for your attendance today. We look forward to seeing you next week and the following week at our Brain Health Forum. Thank you.
Hey everyone, so in a few minutes, we're going to be having CEP Community Live. That is a different webinar hosted by us here at the CEP Research Project. Today, we're going to be joined by our functional independence team, Maureen and Tracy. So I highly recommend you guys come to check it out. They always have really great recommendations. They're occupational therapists, and they always have really great recommendations on how to make modifications to your home or modifications to your daily processes in life, and just really good tips and tricks. And yeah, so please come and see. I'll be posting a link to register for our event in a moment. It is a different registration from BrainTalk Live. However, we do share a same YouTube channel. So if you'd like to catch up on this or any of our other ones, please come check out those videos. So yeah, I'll be posting that link in a moment and hope to see you all there in about 2 minutes.
Again, thank you all so much for your attendance today. We look forward to hearing from you next week and the following week at our Brain Health Forum. So I have nothing further. I'm going to be on here for a little bit longer trying to answer questions. So thank you all for your attendance.